I don't know many people who wouldn't tell you that this isn't the most important civil rights decision that we have for people with disabilities in this country. Because it's a United States Supreme Court decision, all of the states, North Carolina included, have got to come into line or comply with what the court said in the Olmstead decision. I just want to acknowledge that these are my heroes. This is why I went to law school. There they are again, Lois in purple, Elaine in white, and the attorney that led the charge, Sue Jameson. Now, the Olmstead decision comes from a piece of law, the Americans with Disabilities Act. It got passed in 1990. And it has in it what we call the integration mandate. Basically, that mandate says that people with disabilities have a right to get services in the most integrated setting that'll meet their needs. The ADA has got its own rules or regulations, and the regulations tell us a little more about what the integration mandate means. Those regulations say that an integrated setting lets people with disabilities be without people with disabilities or people who are temporarily able-bodied to the fullest extent possible. So what does that mean? It basically means that people with disabilities have a right to live in the community with everybody else. Well, there was 9 years that went by between the passage of the ADA and the Supreme Court saying, we need to tell you a little bit more about that integration mandate. They did that in the Olmstead case. And the court told the country the changes that it was going to need to make in the way that we think about where people live and how people live their lives. The Olmstead decision, at least in my opinion, changes the way that states go about supporting people to have what I'd call everyday lives. And the Olmstead decision is the law of the land. That means it's the whole United States. So what did the United States Supreme Court, Justice Ruth Bader Ginsburg, say in Olmstead versus LC? The court said that the unjustified segregation or separation of people with disabilities in institutions was, these are their words, unlawful discrimination under the Americans with Disabilities Act. What does that mean, unlawful discrimination? It means that it's against the law to treat somebody less well than other people because of their disabilities. And in Olmstead, it means that it's against the law to require people with disabilities to go to institutions or other large segregated places just because they need services. More about what the court said in Olmstead. The court said that state agencies like DHHS and their partners like LMEMCOs and providers must provide community-based services to people with disabilities when such services are appropriate. That's a whole lot of the time, folks, if not the vast majority of the time. They have to provide those services when the person isn't against getting services in the community. That means that people and families and guardians get to make the choice that's right for them. And lastly, that offering community-based services doesn't make it hard for the state to run a service system for people with disabilities. So that's sort of the legalese. I put it in my own language, but I think that's more or less what they said. Ruth Bader Ginsburg went on to say that if a state got sued in an Olmstead case, that state could potentially defend itself if it had, and these are the court's words, a comprehensive, effectively working plan and a waiting list that moved at a reasonable pace. So what we're doing in North Carolina with our Olmstead Plan is lining up our service delivery system through that plan with the United States Supreme Court case, Olmstead versus LC. So, who's North Carolina's Olmstead Plan about? It's about people with disabilities who live in facilities. What does that mean? For example, a developmental center, a psychiatric hospital, a skilled nursing facility, an adult care home. It's about people in other segregated settings too. For example, sheltered workshops or segregated day programs, or a program for children, psychiatric rehabilitation treatment facilities. Olmstead is also, though, about people who are at serious risk of entering a setting like those I've described. Our plan covers all people with disabilities of all ages, both adults and children. And those are all people with disabilities in the public system, I should add. The Olmstead Plan is a blueprint for offering people opportunities to live and work and receive services in the community in integrated, inclusive settings. It's a plan to help people get out of institutions or to avoid going there in the first place. Another way to think about it is it's a lens for the work that every professional does every day. It sets out priorities for what the state's going to do and the action steps the state's going to take, and the goals and outcomes that the state plans to achieve by moving the Olmstead Plan forward. At least as long as I can remember, when we do work like this in the Department of Health and Human Services, we put together a group of people to advise us. The Olmstead Plan has a stakeholder advisory. It's a very diverse group of people. They don't always disagree, but everybody's offering their best thinking on this. It's made up of policymakers, legislators, 2 Republicans, 2 Democrats, 2 senators, 2 representatives, people with lived experience, and professional organizations, agencies, and associations. When the OPSA, that advisory, meets, it's quarterly and it's always open to the public. It's chaired by 2 really talented people with lived experience, Betsy McMichael, who's handling our facilitation today, and Brian Dooley, the chair of the Council on Developmental Disabilities. So what's happened so far? I'm going to tick this off kind of quick. We hired HELP, the Technical Assistance Collaborative, and they did a really long report. I put the link to it there to sort of tell everybody what the state looked like, what we had going for us, and where we had work to do. Then the department hosted its first Olmstead Plan stakeholder advisory in July of 2020, and working with the TAC, as we call them, the department put what it heard from lots of different people into a plan for the first 2 years, calendar year 2022 and 2023. We also put together a staff work group. It crosses about 8 or 9 divisions. It's a group of people with expertise in program issues in the Department of Health and Human Services or data issues. Next, hired this really brainy group of people, Mathematica. Their job is to help us gather data and to pick or develop the measures that are going to tell North Carolina how the state is progressing in its implementation of the plan. The Olmstead Plan itself includes 11 priorities, and I wrote those out there, and I'll mention a couple of them. I ain't got time to mention them all. Strengthening choice, addressing the direct support professional crisis, increasing competitive integrated employment, increasing input from people with lived experience and using data for quality. There are other ones, and I've listed them all 11, I think, there. The department updates the plan and puts out reports on the website that we have every 3 months, and we are gearing up right now to write the 2024-2025 installation of the Olmstead Plan. A couple of things about the plan. The plan overarches, it umbrellas over transitions to community living. That is a settlement agreement. We got sued. The state of North Carolina got sued. And it's an example of the state coming into line with Olmstead. I always call it Olmstead in action, but it's for just one group of people. It's for people with serious mental illness and serious and persistent mental illness. The plan also builds on money follows the person. I have the opportunity to work with my colleague and friend, Steve Strom, who directs that. Money follows the person is the federal government giving all the states that decided they were in money to push the Olmstead agenda and build their community capacity. The Olmstead Plan also connects to our strategic housing plan. That plan includes the people with disabilities that are part of the Olmstead population. The Olmstead Plan includes standard plans, and when they go live, it will also include the tailored plans. It embraces diversity, equity, and inclusion. This is the vision statement that the Olmstead Plan Stakeholder Advisory adopted. North Carolina champions the right of all people with disabilities to choose to live life fully included in the community. The bottom line is this plan is a huge change of thinking in the way that professionals do their work and in what families ask of us. It gives community inclusion a huge boost. It's a new language that everybody will speak and a lens for seeing a world where everybody belongs. But it's going to take all of us advocating and working together.